guys, quick quick story lang actually. So, for today's vlog, we are going to talk about my experience on my journey on my breast exam procedures that I've done a few days ago. So, at the start of the video, I'm gonna show you my experience on the first day. So basically, I went into a clinic and I got checked up about my breast because I was concerned about my breast, my left breast, because I feel like something going on out there and I'm having pain all the time. But I know that normally if your period is coming, it usually get tender, your breast get tender, or yeah, you feel the pain sometimes in there. So but anyway, so it's been bothering me a couple of years ago since then until now. So finally I decided to get it checked. So I went in there. They did ultrasound on me first, and then oh no, actually sorry, I went into a clinic and then I got tested. The doctor checked it, touched it, and she told me that it's just maybe my breastbone that I'm feeling, and she don't see anything wrong with it. But she did schedule me for another checkup, which is I was getting a mammogram. So she suggests me to get a mammogram checked, so then I can how to say that, so I can get checked more. I mean, to make sure that there's nothing in there. So she suggests me to go there, and so they gave me a schedule. I called the place, and then I got a schedule like maybe 2 weeks after. And then the first time I had to cancel it because I think something came up, and so I had to reschedule my appointment for my mammogram. So I went in there. Finally, the day came. So I went in there. Of course, I have a face mask because they're all required. Everyone's gonna go to any clinic or anywhere in here in America or anywhere else, you have to have your face mask on. So I came in there by myself, and then I got checked in. They checked my insurance and stuff, and I'm waiting. And I will show you guys the video before I go inside, or before they call my name to get my mammogram check, my breast check. So anyway, yeah, ayan, dito na ako. Meron akong appointment today. Ayan. Paano tayo? Ultrasound. Ayan, ito na tayo. Bihis muna ako. Ayan guys, nakabihis na tayo. Para kung kape muna. Kape muna. Ayan. Ultrasound tayo guys. Kaya tayo. I went inside, I gowned up, and then finally they called me in to the other room, which is the mammogram machine. So that's my first time to see a mammogram machine. So I was skeptical a little bit, but until then she asked me, the lady or the assistant asked me to do this position and that and that. So I felt a little discomfort when doing that, because you have to put your breast on that place. So usually they press your breast a little bit like that. You have to hang your breast like that, and then they have to do the sideways. But anyway, so I got all that done. I'll show you the picture of the machine or the room, what it looks like. It's a small room. And then guys, dito ako sa nagpamamagram ako guys. That's why I make up right now. Diyan ako, yun yung machine na ginamit para i-test yung aking dalawang bola dyan. Ayan po. So, ayan ang kanilang kagamitan. Ito ko sa room. Ayan. And after that, they told me you have to wait here. We will do a ultrasound on you. So at the same day, at the same time. So I waited in the room. After that, they called me to the other room. I'll show you the picture also. So I went in the other room. Finally, they called me, and I lay down there, and of course I'm still on my gown, And then I lay down, they put gel on my left arm, and they have a monitor. You can see there's a machine or a tools that they put in here or pointed it here on my left breast to check, and then you can see it on the monitor what's going on there. So I can see over here on the right side where she is or where she at, that there's something on there. There's something on that screen. So it looks like a dark shade picture. So she took a picture of that, shot different kind of shots, and then she sent it to the physician outside the room, whatever in it. And then she asked me to wait after the test. She asked me to wait on the same room, and then she came back with the physician, and then the physician told me or suggests me. She told me, I was a little bit nervous. So she told me that I have to. They saw something on it. They saw something on the images on my ultrasound and mammogram. So she told me that there's some dense tissue on my breast, and for me to, or for them to be able to see what's going on in there, I have to go on a biopsy. So they have to schedule me to get a biopsy done, so then I can get a peace of mind. So then I don't have to worry. As long as you get that biopsy checked, then they will know what's going on there. So, ayun guys, kailangan ko ba mag-ultrasound ako naman. Next naman yan. Ayan, nagpa-ultrasound ang lola nyo. So, chinek nila yung dibdib ko. So, sabi nila, kailangan ko daw magpa-biopsy. Ay, kinakabahan ako. So, of course, I was nervous. So, before I step out the clinic, they asked me to talk to a financial person. So I talked to her, and then she told me that you can go home today, and then we will call you when we can schedule you for your biopsy. And so I went home, and then after a few hours they called me, and then they gave me a schedule. Okay, and then after that I didn't had a chance to go on that schedule, so I had to reschedule again. Oh, it's because I think, but yeah, there's something going on, so I had to reschedule it. And then finally it came. So I'll show you the video of before, when I was on my way to go to get my biopsy done. All right, guys. So for today's vlog, well, I'm just gonna go for my checkup today. It's not a checkup. It's actually I'm scheduled to do a biopsy on my breast, and so yeah, I'm a little bit nervous right now. I guess it's normal, because it's a different feeling if you're the one who's gonna be a patient. It's way different than you're the one who's taking care of others. But yeah, so we'll see. Hopefully everything will be okay, and yeah, so we're gonna have to go ahead out there today. See you later. Anyway, so I came in there maybe like after 1 week, my schedule. So I came in there, but they don't allow me to blog or to record anything in there. So my experience there was like, I was really nervous, because I know it's different, because I'm also in a medical field, but it's a different feeling if you are the one who's gonna be a patient. You know what I mean? Like, it's different. You're the ones taking care of others, but at that time you're the one who's the patient. So it's different feeling. So you're still gonna feel like weird and feeling nervous. So it's normal. So anyway, I came in there, I went in there, got checked, and then when I went to the room, it's a different room. Well, it's actually like an ultrasound room also. So I had to lay down there, and she had to put a gel again on my left breast, and do the ultrasound again to make sure that the area is still there, or the area is, just to make sure. So for instance, yeah, just to make sure. So she took a pictures of again on the monitor, and then she set it up, everything that the doctors need to do the biopsy on me. So I saw the needles. I saw some liquids in a jar, anything that the doctor needs to do my biopsy. So it's in the tray. She already set it up, and then she asked me to gown up again, change, and wait here. So I was laying down there, and then the doctor came in and then greeted me, of course, and I said I'm a little bit nervous, so like that, blah blah blah. So I went in there, and then the doctor get ready, wash his hand, and put the gloves on, and the assistant put a pillow on my side over here to make me look like this, like sideways, so it's like this. So, and then my arm is kind of like that, so my arms should be open, so then it's away on my chest, away on my breast. So anyway, did that. So then the doctor started injecting me a anesthesia at first, because that's the one I'm scared about, the anesthesia. Even though it's just a needle, it's funny because yes, I am in a medical field, but I'm still nervous. I'm still scared about needles. I know it's funny, but yeah. So they inject something on me. I felt it, and that's what I don't like about needles. You will feel it the first time they put it inside. So they told me, well, I know that they said if you do a biopsy thing, when they put you anesthesia or give you anesthesia, it's the same feeling when you get a dental procedure or something. So it's the same feeling when they inject something on your gum. That's how it feels. So when they inject it to your gum, it's the same feeling like the medication is just going in, especially that, right? You can feel it. So it's the same feeling like that. So that's how I felt it. So I felt like and then later on the doctor like trying to pinch something like this, and I can feel the pain. But then the assistant, I wasn't looking the doctor, I was over here like this. I was talking to the assistant and I said, oh, I can feel it like that. But they told me it's okay, it's just a little discomfort, you'll be fine, like that, blah blah. The medication is affecting, so it's going through your cells or your tissues, and that's how you feel it. But I guess that's what the feeling for me, I guess, is that it's just the injection. But overall, that's actually the doctors going in already with that long. I will show you guys the picture of the needle that they usually use for doing the biopsy. So it's a long one. We call it hollow needle. So I'll show you the picture, and then before the procedure starts, the doctor told me that I may hear some click 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 on the while he's doing the procedure. So I already know that this is gonna happen. So anyway, so he did like that. He's trying to press something in here, but I didn't really see what he did and felt the needle going in. But what I feel is that he's putting like, I feel like he's putting a pressure on my chest, on my breast. That's how I feel it, and I'm like, like that, just like that, I'm like, oh, it's normal, like that, blah blah. And then later on, it's done. It's just like maybe less than 10 minutes overall. So, and then after that, they told me, they cleaned up the wound, and they put the small metal before the procedure starts. The assistant showed me it's like a thick glass, and it there's a metal thing in there. She told me that we're gonna put this metal on you, on that spot where we're getting your biopsy done, because the purpose of that is just to make sure that when I go to my next visit, if I'm gonna go to mammogram check again or ultrasound again, they will detect which area is the one I get biopsy done. So then they will know if there's something going on there. They know that area is already done, so they can get another biopsy or another test on that area. You know what I mean? So yeah. So anyway, I didn't even felt it because it's a really tiny metal. It's just a mark. It's like a mark. So, but of course, I asked that the first that is it gonna bother me at all if you guys put that in? If I go to an airport, if I go to a metal check something detector, are they gonna bother me at all? He said, no, it's safe. So she told me that, and then I signed up consent, of course, before the start of this procedure, and then boom, that's it. They already started and they did what they need to do, but after that I saw the tissue. I saw the tissue that they took out of me on the tray, and then the doctor like putting it in like a jar or something. I'm not sure if he put it in a jar, but I saw like a 2 piece laying on the small tray. But anyway, yeah, so it's done. So they told me that after 2 days they will give me the result. They will call me. They will call me to go there in person. But then after one day they called me when I went home. They called me that we're gonna do a phone call instead of going there, just because we limit the people that go in the clinic. It's because of the pandemic stuff. So anyway, I got that call. Actually, I got the call yesterday. It was yesterday, July 8th, the result. And I'm like, I was planning to take a nap, but I couldn't take a nap because I'm nervous and I'm still waiting for the result. So, yeah, they called me, and then